Hi, everyone. Welcome to another episode of Active Aging. My name is Danielle Procopio, and I'm your host. And today, Jeff Koontz, the Director of Rehabilitative Services for Steward Healthcare, has joined us. Jeff, I want to say thank you for spending some time with us today.
Thank you for having me, Danielle.
Of course. For those of you that might not know Jeff is the Director of Rehabilitative Services at Trumbull Regional Medical Center, Hillside Rehabilitative Hospital, and most recently, Austintown Rehabilitation Services. Jeff has been specifically at Hillside for 11 years and has been a treating therapist for 14 years. Jeff graduated summa cum laude from Youngstown State University, where he earned his doctorate in physical therapy. And Jeff, we are very lucky that you chose to stay here in Youngstown, Warren area and work with all of us to make sure that you keep us moving and get us moving a little bit better. So thanks for staying.
Absolutely. I do love this area.
Very good. So you've been at Hillside now for 11 years. Can you tell us a little bit about Hillside Rehabilitation Hospital?
Absolutely. So Hillside is one of the best kept secrets in the Valley. Hillside's been here for 58 years as a rehabilitation hospital. Prior to that, it was a tuberculosis hospital. So what a rehabilitation hospital is it's just that. It's a hospital solely focused on rehabilitation. So our patients come to us, they stay within the hospital. Our typical length of stay is about 2 weeks. So during that 2-week stay, the patient's going to have physical therapy, occupational therapy, if they need it, speech therapy. Our hospital offers 24/7 nursing care, that's RN, and specially trained registered nurses in rehabilitation. Also, 7-day-a-week physician coverage. You're going to see your physician almost daily. So our physicians are called physiatrists, and they're specialized in physical medicine and rehabilitation.
I had no idea about the history of Hillside Hospital, but I totally agree. It's one of the best kept secrets. Hillside is such a great resource for the Mahoning Valley, but I didn't realize it was a tuberculosis hospital starting out. So what cool piece of history there.
Absolutely. There's still a part of the building that says tuberculosis on it in bricks on the outside.
Oh my gosh, who knew? And you've been there for 11 years, so I'm sure you've seen a lot of changes over the years that you've been there. And I think that there's a lot of parts and pieces that people might not realize about Hillside. So what sets it apart from other facilities, Jeff? Why is it the best?
Well, for inpatient rehab, it is the best because of the specialized care that we're able to offer. One-on-one individualized treatment. So you're going to see your physical therapist one-on-one. You're going to see your occupational therapist one-on-one. We don't group patients together 3-4 at a time. Occasionally you might be with another patient, or you might do an activity with another patient that's going to benefit you in your rehabilitation process. When you come into Hillside, we're going to evaluate you on day one. So you come in, you're going to get up, you're going to get a bath, you're going to get dressed. Occupational therapy is going to work with you. They're going to see what your deficits are, what you need to do to be able to go home to take care of yourself. You're going to go then with physical therapy. They're going to see how you're able to get in and out of bed, see how you're able to walk, how you're able to transfer, and then really work on those high-level deficits that you may have that are resulting from your injury or from whatever caused you to have to come to Hillside. Mm-hmm. And speech therapy is going to work on your cognition. Maybe you had a stroke, or maybe you're just a little bit foggy from all the medications. They're going to work on that. They're also going to work on if you have swallowing deficits, if you need a modified diet. So really just a team approach. The physicians are there, they're in the gyms, they're going to see you working with the therapist, they're going to ask the therapist questions. Nursing, they're going to meet with nursing as well. The team all gets together at least once a week and discusses your case. What's going on with you? What do you need to have in place to go home? Case management's there. They're working from day one to see what you need to go home. They're seeing what devices you might need, what modifications might need to be done to the home, and then setting up your services when you leave, your physician appointments, your therapy when you leave Hillside.
Absolutely. And I think let's take a step back for a second. So the experience that you just talked about, in the hospital world, we're going to call that an inpatient visit. So for my friends that might not be as familiar with the difference, when you have someone that's actually staying at Hillside for a long-term stay, and long-term meaning, like you said, 2 weeks, more than just popping in and popping out, that's going to be an inpatient visit. So you're going to be staying overnight like you would at the hospital. And then also there's outpatient where I'm going to come and I'm going to get my therapy and I'm going to leave. So when we're talking about the meals and the baths and all that, that's specific to the inpatient services. And I think you did a really great job of kind of giving us an overview of what a typical day is going to look like. What types of patients are you seeing for that inpatient visit? So help us kind of understand the difference between I'm coming to stay at the hospital overnight versus I need therapy and I'm popping in.
Right. So typically the patient who's going to come stay with us as an inpatient is somebody who had a major change in their functional mobility level. So they're not able to return home by themselves now. They maybe were independent with walking prior to their injury or to their illness, but now they're not able to do that. And they're needing assistance with everything that they need to do to function at home. So that's really the patient that we're going to see. The primary diagnoses that we see here at Hillside, our top diagnosis is stroke. From there, we also have brain injury, both traumatic brain injury from, say, a motor vehicle accident or a fall, or a non-traumatic brain injury, which could be from a blood clot or other cause. We also see patients who've had amputations, spinal cord injuries, multiple sclerosis, ALS. So really any diagnosis we can take as long as it's, you have that impaired functional ability.
Mm-hmm. And you mentioned, your stroke patients and brain injury. And, a few years ago, we had a loved one that had a brain bleed and was, in a local hospital for an extended period of time and did need some rehab. And, of course, I work in healthcare, so all the players and all the pieces. And it was interesting when we were talking with the staff and Hillside came in and was talking with the rest of my family who might not know all the things. And, people don't realize what an amazing program Hillside has inpatient when it comes to traumatic brain injury or, stroke recovery. And, I know that that's a much bigger part of the team than just what you're doing. But can we just talk for a minute about the program that you have for inpatient, for those that are recovering from some type of neurological trauma?
Right. So let's take stroke, since it's our biggest diagnosis, and really most people can identify they have a loved one who's unfortunately suffered from a stroke. So our stroke patients, it would be all three disciplines of therapy. They're going to receive physical therapy, occupational therapy, speech therapy. Those disciplines, they're working together to really see what that patient's deficits are, work on those deficits together, and get that patient home. The physician, they're really seeing what medications the patient has. They're weaning off some medications because after the stroke, they're going to be on higher levels of medications from acute care. So they're weaning down some medications. They may be adding a couple and really getting that balance right for the patient. Case management. Case management's working with the patient. They're talking with the patient, seeing what resources they need when they go home, trying to set up those resources for them, because there's a lot that's out there in the community, but you have to know where to find it. And our case managers are excellent at doing that. They're working with the equipment providers to make sure that the wheelchair is ready if they need a wheelchair, a walker, a cane, whatever it is they need. We're also working, say if you need a leg brace, we're working with orthotists to get that leg brace for you, to make sure that you're able to walk at the highest function that you can safely. Support groups. So when you're discharged from Hillside, we set you up with our stroke support group. We also set you up, if you're able to, come to outpatient therapy at Hillside. If you're not quite ready for outpatient, we're going to set you up with home health therapy and then transition you to outpatient. So we make sure that your care is continued even after your inpatient stay here. We really want you to get back to as much independence as you can.
Yeah. And I think that Hillside does such a great job. And, again, I really have to applaud the work that you're doing with those that are, working through different neurological conditions. And the fact that we have such a wonderful resource that, is recognized, at the state and national level for what, the work that you're doing, and you don't have to go to Cleveland, you don't have to go to Pittsburgh. You've got somebody right in our backyard that's doing such great work. I think it's important for our viewers to know that, if someone you love has had a stroke and needs that rehabilitation, you've got world-class service that's going to get you back on your feet at Hillside. So it's a great program.
And we are Joint Commission accredited and CARF accredited. So those are independent surveys that we have to be reaccredited every 3 years for. So it just puts us at that higher level of standard.
Absolutely. So when you were talking us through what that program looks like, you had talked a little bit, about the outpatient therapy piece. So for those of our viewers that might not have had the pleasure of engaging in outpatient therapy or know what that looks like, I know we've already talked a little bit about it, but can we talk a little bit about the outpatient experience at Hillside?
Absolutely. So for outpatient therapy, currently we do offer 2 sites. So we have our Hillside main campus here in Howland, and then we also offer Austintown Rehabilitation Services in Austintown, which is on Route 46 near New Road. So let's start with physical therapy for outpatient. That's the one that most people have experience with. So physical therapy, and for our outpatients, it ranges from continued treatment from inpatient to outpatient, but also for those who haven't had an inpatient stay but still have a functional deficit that needs attention. So we work with the neurologic patient. We also work with orthopedic patients. So it could be you had a total knee replacement. It could be total hip replacement. It could be even less injury. It could be an ankle sprain. Shoulder dysfunction, all kinds of rotator cuff tears, shoulder surgeries, back pain, neck pain. I mean, really, our therapists, they're experts and they're very well versed in a multitude of conditions. And so whether it's that high level injury, more athletic, or the neurologic injury, we treat it. So in our outpatient services too, we go from pretty much birth to the end of life. So we treat patients of all ages in outpatient. So we do offer pediatrics, PTOT and speech, and adult PTOT and speech.
I feel like you're reading my mind, because as you were talking, I was like, I wonder if Hillside works with kids. And so it's good to know that at any part of the life cycle, we can come to Hillside. And I am very excited about your newer location in Austintown. It used to be at one time that you had to be willing to drive out to Hillside or, be in Trumbull County in order to easily get your services. And so now that there's the new location in Austintown, it's making it a little easier for our friends in Mahoning County to receive that same great service. I want to talk to you a little bit more about the outpatient piece, but before we do, can you tell us a little bit about the Austintown location? I'm assuming that's strictly outpatient at Austintown.
It is. So Austintown is strictly outpatient. So Austintown does offer outpatient PT, OT, speech, both adult and pediatrics. So Austintown is a very convenient location. It's on Route 46 near New Road, right by if you're familiar with the area, the ASECU Credit Union. Minutes from Canfield, right for Austintown. Freeway access is good off of 11 or 46 or 80. So, I mean, really just a nice location, nice big windows, open setting. Our pediatric has a whole separate side, separate from our adults. So it's nice to keep the kiddos and the adults separate. Sometimes adults are noisy, sometimes kids are noisy. So it's just a little better to have the separation there. Things that we offer, we'll get into occupational therapy. I didn't talk about an OT yet. So some more specialized things that we offer occupational therapy wise, lymphedema treatment. So those who are suffering from lymphedema, swelling in the legs primarily, also upper extremities. We do have a certified occupational therapist who does treat lymphedema, both Austintown and Hillside.
Good.
We also offer OT driving evals. So that's something that's really specialized. Those are at Hillside. But we have an adapted car. So if you need hand controls or different adaptations, we have a driver or OT who's specialized in those driving controls. We have a vehicle that we use that has the hand controls in them. But even if you don't need hand controls, but you've suffered an injury, maybe post-stroke, post-brain injury, and you're just not sure if returning to driving is safe or safe for your loved one. Well, we offer that service. State certified occupational therapist for driving. She's going to make that determination.
Wow.
First starting in the clinic, checking reaction time, vision, making sure it's safe to go on the road, and then get out onto the road and see what happens. And then if it's kind of borderline, maybe you need some training, we also offer driver training so that we can retrain you how to drive so that you're safe to be on the road. So it's not necessarily a done deal that you can't drive. Maybe you just need some training to continue driving.
And what a great resource, working in aging services, there's so many conversations with families about driving and is it safe and should mom or dad be on the road? And, sometimes those conversations are totally legitimate and sometimes they may be a little premature. But especially if someone has some type of illness or injury that affects their reaction time or, if it's something neurological and they want to get back on the road, what a wonderful resource for everyone to know that there's a professional that can evaluate you and identify what some of those deficits might be, or, give the stamp of approval and say, hey, you're okay and you're safe on the road. And then to have that ability to receive training or, education or rehabilitation to try to get you back to the point where you can drive again safely. And I think that, if we talk about nothing else today, and that's the one piece of value that we bring, I think that would bring a lot of peace of mind to families and to patients. And then also just to know that, if you are struggling, there might be a path to take to kind of get you back on the road safely. What a wonderful program. I'm so excited to hear that that's something that Hillside offers.
Yes. So let's talk a little bit about speech.
Okay.
Speech therapy. So people have mis thoughts about speech, what speech is.
Absolutely.
Because it sounds like, okay, it's just about talking. However, speech works on so many different levels. So yes, they do work on pronunciations, on talking, on things like that. But they also work on cognition. So if you're having difficulties with remembering your medications, with formulating ideas, formulating thoughts, they're going to train you on how to do that. They also work on swallowing as well. So if you are, say, post-stroke and you're having difficulty swallowing, that's very common. It's called dysphagia. That therapist is going to work on modifying liquids with you first to make sure that that liquid is going, down the right, as we say, down the right pipe. Because if it goes down the wrong pipe, high risk of pneumonia. So we don't want that. That can, ultimately lead to death. So we want to avoid that at all costs. But while they're modifying their diet, they're also retraining your muscles on how to swallow correctly. They're teaching you ways to swallow correctly to make sure that the fluids in the food go down into the correct pipe. For those who have severe communication barriers, maybe non-vocal, it's a pretty severe brain injury, stroke, and non-vocal. Well, they can work with what's called AAC devices. So those are electronic devices that patients can use to communicate with. So the therapists are trained on how to program that device, how to train the patient to use that device, so that device then can speak for the patient, and the patient can use that for better communication.
And you have these services for speech for all ages. Is that correct, Jeff? Okay, because I know it seems like we have a lot of use for speech. You see a lot of use of speech therapy in very young, and then we see it again kind of as people start to age and you're seeing strokes and dementia and whatnot. And I know that in my first introduction to speech therapy was actually with one of my kids, and I was so surprised to hear all the parts and pieces that are available. It's so much more than talking. And I've been involved with the development of a dementia unit. And so one of the things that I found so interesting that people probably don't realize, a lot of times a speech therapist is the person who's coming in to stage the cognition level. And so that's not what you would expect, that, that so much of what we do with Alzheimer's patients is driven by the speech therapist, but it is. And so, I have a whole new appreciation for speech therapists, and, they're really making a difference. So it's good to know that anyone of any age that might need those services, we're able to receive those from the different clinics that are available at Hillside. So, or at with Stewart, not just Hillside. So it's good. So I can only imagine from the outpatient's perspective, there are probably hundreds of diagnoses that you're seeing patients for, and we've talked about a lot of those. What are the most common diagnoses that you're seeing for your outpatient clinics?
I mean, it really does vary a lot. But I mean, a lot of total joint replacements, orthopedic injuries, and then into a lot of the neurologic, the post-stroke, brain injury, and just, it's the nice thing about Hillside and Austintown is that we see so many diagnoses that we're not just specialized in one. We have therapists who are more specialized in one versus the other, and we'll try and put you with that therapist. But it's such a large treatment environment that there's just the overwhelming sense of knowledge from all the therapists who collaborate on all the patients, so that it's not just necessarily one patient seeing you or one therapist seeing you, because that therapist is talking to the other therapist, getting treatment ideas. If they are stumped, or if you are kind of plateauing, they're going to try and bounce ideas off another therapist. Hey, what can we do to really advance this patient? Is there something that I'm missing with this patient? So it's that whole team approach that continues into the outpatient department, modeled after the inpatient, that we really try.
And that makes a big difference when you have a team approach, and it's not just the physical therapist in an isolated island or silo treating the patient without having those conversations with everyone. So it's so good to hear that that is the approach that Stewart has chosen to take with therapy. And then also, I didn't want to forget mentioning too, that lymphedema treatment. That's such a specialized treatment. And I worked in hospice for several years, so we had so many patients that needed it, and we really struggled to find people that were willing to provide it, or that were trained to provide it, I guess I should say more. So it's great to know that if we have that need, we know exactly who to call. We call Jeff at Hillside, and he'll take care of us, and he'll get the patient lined up. But you just have so many great specialized programs available to the community, and I'm glad we're talking about those today. Now, I'm excited, obviously, about your new Austintown community. Are there any other plans for expansion into other markets? Should we be looking for additional rehabilitative services anywhere else?
Yes, so we're looking to expand on Elm Road. So the Elm Road Medical Park, that's a Stewart facility. So we're going to have physical therapy open there. Hopefully, we're looking in a month or two. We'll hopefully have that facility up and running.
Okay, and that will also just be outpatient, just to clarify.
Right. Just outpatient.
Perfect. Yeah, well, because you've got, and again, you have two options now for inpatient between Trumbull Memorial and Hillside, and then we've got these options for outpatient. One of the things that we didn't talk about, Jeff, and mentioning the hospitals again is going to make me think of this, is I want our viewers to kind of understand where Hillside fits into the healthcare continuum. Because a lot of times when we talk with patients, there's that question of, well, do I need to go to skilled nursing? How does this work? And most of your inpatient, if not all of your inpatient patients, are going to be coming from a hospital setting. So, whichever hospital they might be from, they're going to then transition to Hillside. So can we talk a little bit about why Hillside instead of, or before, or, in place of skilled nursing? Like, why would I come to you as opposed to ABC nursing home?
Okay. So there's a difference in level of care. So Hillside is an inpatient rehabilitation hospital. We are a hospital. So we do have 24/7 registered nurse coverage. We do have 7-day-a-week physician coverage. The physicians are in-house. We have employed physicians, full-time physicians here. At a skilled nursing facility, it's a lower level of care versus the inpatient rehab facility. So at a skilled nursing facility, your physician does not have to see you a set number of times per week. They have to see you typically once to twice a month. At Hillside, your physician must see you 3 days a week. Our physicians typically see our patients 5 to 7 days a week, just because we like to have that one-on-one care. We want to make sure that every need is taken care of and that you're medically sound. Plus, we only have 14 days typically. So we need to get you moving, get you home, and get you as independent as possible. The skilled nursing level as well, their therapy is not, I'm going to call it intense, but it's not as much therapy. So intense is kind of a scary word. It makes people think that it's like hard hit exercise, that we're running you through everything 3 hours a day. What it is it's all the things that you're doing that are therapy. It's getting bathed, it's getting dressed, it's transferring. It's every time that you're working with that therapist. That therapist isn't saying they're having you do, calisthenics and,
Right.
jumping jacks and everything for 3 hours a day. But that is the difference, is that at an inpatient hospital, rehab hospital, you're going to have at least 3 hours of therapy a day. Typically at Hillside, you're going to have 2 hours of physical therapy, 1 hour in the morning, 1 hour in the afternoon, an hour of occupational therapy, which does typically include bathing, dressing, things like that. We have kitchen setups, so you're going to be learning how to, adaptive ways to cook, to clean, to do all those kind of things. At a skilled nursing facility, you're going to have therapy and you're going to have physical, occupational, speech therapy, but the requirement's not there. So they don't have to provide 5 3-hour days of therapy a week. That's what we have to provide.
Right.
But you might get 1 to 2 hours a day, depending on your needs. Now, if you're not able to participate as much in inpatient rehab, then the caseworker at the hospital may suggest a skilled nursing facility level for you until you're able to tolerate more. Sometimes you might even be suggested for a long-term acute care hospital,
Right.
called an LTAC. So an LTAC would mean that you have a very high medical need and a very low therapy need at the moment because your medical need is too high and you can't tolerate. Both of those locations, though, you can then transfer back to an inpatient rehab hospital. So we take a lot of patients from long-term acute care hospitals, from LTACs, who have progressed, their medical need has decreased and their rehab need has increased. So they're able to then come to Hillside, get the intensive therapy that they need to return home. And the same thing for the patient who wasn't able to tolerate as much and went to the skilled nursing level. We're able to take those patients as well and then get them the intense rehab that they need to return home.
And I want to say something to our viewers because, I'm sure now if something happens and someone has an illness or an injury, they might say, I don't want to go to skilled nursing. I want to go to Hillside, which is a great problem. But, that's not something that necessarily we as patients are able to decide. That's typically dictated by our diagnosis and what our acuity level is and what our physician sees. And of course, what our insurance provider thinks is appropriate. So, we're not always the ones that get to choose the level of care. Sometimes we're in a position where we get to choose, but more often than not, our situation is going to kind of dictate where we go. But I do think the word intense is correct. It is a more intense environment. From seeing patients at Hillside, the biggest thing that I can say is the difference is that there's therapists everywhere. You see them on the floor, you see them in the patient rooms, you see them assisting with bathing and toileting and all those parts of our daily living activities. And while you do see that also in skilled nursing, it's not quite to the point that you see it at Hillside. And if you're recovering from a stroke or a major illness or injury, I think it's appropriate to have that higher level of therapy involvement because, there is a right and a wrong way to do things when you're recovering, and you can make things worse if you don't know the right way. So I think that, it's wonderful to have so many options between the LTAC and the rehabilitative hospital and skilled. We're very fortunate to have as many options as we do in our market, and home health if you're able to go home. So it's a real blessing as a consumer to have these problems.
Yeah, and one bit of advice I can give on insurance. So if you're
Yes.
if everybody's saying you should go to Hillside, it's appropriate, you need to inpatient rehab, and your insurance says no, advocate for yourself. Call the
Absolutely.
insurance, say this is what the physician's recommending, this is what the therapists are recommending, case management, why are you denying me? Because unfortunately, we are a higher level of care, which would be a little more expensive, and insurances routinely like to deny that level of care. So the main thing you can do is advocate for yourself, advocate for your loved one, and hold your insurance accountable for their choices.
Well, hopefully we've helped some viewers clear some questions up. And again, if you have any more questions about Hillside, or if you think you need to experience outpatient therapy, or there's an injury or illness you're recovering from, please remember Jeff and his team. They'll take great care of you. With that, Jeff, thank you so much. And viewers, we will see you guys next time. Have a great day.